As someone who has undergone breast cancer treatment, I wish to share my thoughts on my journey and hope that it might help someone else. I was diagnosed with early-stage breast cancer, so early that I was not recommended to have chemotherapy. This was possible because I had mammogram and breast ultrasound screening. So this was the chart which the sonographer drew after my ultrasound examination. Can you imagine? I had 22 lesions in my breast, all of which I could not feel. What were these? The radiologist reported that one lesion at the 12 o'clock position of the right breast had margin irregularity and should be closely followed up, or a biopsy should be performed. My attending surgeon, however, recommended biopsy for 4 lesions. I have to confess that I was very skeptical of her advice. I remember thinking that she just wanted to earn more money by doing 4 instead of just 1. But I agreed to undergo it despite my initial misgivings. As things turned out, it was the right decision on my part. And it was not the lesion in the right breast that was highlighted by the radiologist which turned out to be cancer. It was one of the other 3 lesions on the left breast that my surgeon advised biopsy for. At the 3 o'clock position on the left breast, I had ductal carcinoma in situ, a form of very early cancer confined to the breast ducts, and there was 1 millimeter of invasive ductal carcinoma. All the other lesions were not cancer, including the 12 o'clock lesion in the right breast, which the radiologist highlighted. Having made the diagnosis, my attending surgeon recommended that I should undergo breast conservation treatment, which involved removing the cancer with a rim of normal tissue all around, preserving the uninvolved breast. My family and friends were a little skeptical of that advice because it was their belief that, in this instance, the whole breast should be removed, which means that I would have had to undergo a mastectomy. Having doubted my surgeon the first time, and eventually finding out that she was right, I decided to trust my surgeon and undergo breast conservation treatment. The invasive part of the cancer was so small that after completing breast-conserving surgery, my medical oncologist advised that I did not need to undergo chemotherapy. I had radiation treatment to the preserved breast a few weeks after my operation. I returned to normal life after radiotherapy was completed. I had breast cancer treatment more than 15 years ago and got my life back weeks after surgery. Since then, I have lived pretty much normally, just as I did before my diagnosis. So what are the important lessons enabling me to emerge from breast cancer treatment back to my normal life? First, take responsibility for breast screening. This gives the best chance for diagnosis of early breast cancer. Next, trust your doctor about biopsy. Be prepared that 3 out of 4 biopsies may be benign. Third, if your surgeon gives you the choice, consider breast conservation treatment. Please note that I'm sharing my experience and thoughts. It is in no way intended to be medical advice. I hope that women who are diagnosed with breast cancer may return to normal life as I did and wish you the very best of health.